We've heard from family members, neighbors, and authorities on the suspect's documented history with mental health problems. Although we do not know specifics on the perpetrator's mental health, there are things we do know when it comes to trauma. And those are signs and symptoms among people impacted by tragedy. Dr. Julie Kaplow, Executive Director of the Trauma and Grief Center at Meadows Mental Health Institute, is back to continue this conversation. Dr. Kaplow, thank you so much for your time this morning.
Thank you for having me again. As
we know, Sunday's shooting is traumatic for so many people who watched from their television, but also people who witnessed this tragedy on the ground inside that church. When we talk about trauma, we know it's not one size fits all. Trauma can pop up at any time, anywhere. What are some red flags we should be on the lookout for?
Sure. I do think it's important to note that for those who were directly impacted, so those who were actually in the building or witnessed the event, we would expect that they are more at risk for developing post-traumatic stress. And for those individuals, I just want to say that PTSD is a normal response to an abnormal event. So there's still a lot of stigma out there about developing PTSD in response to a trauma. But the reality is, if you are witness to something like what happened the other day, it is likely that you will develop symptoms. Now, that being said, sometimes they can dissipate on their own. But for many people, they do need to seek treatment. And some of the signs that you actually have PTSD include being very avoidant, not wanting to talk about or think about what happened, having flashbacks or nightmares, re-experiencing, feeling like the event is happening all over again, or even numbing, where you actually don't have any feelings at all. And if you are experiencing those things, we do want you to seek at least an evaluation to determine if therapy is needed.
Yeah, and talking about this is very appropriate. I think the more we have these types of conversations, it will allow folks who are experiencing trauma to talk about it and perhaps seek help. At what point in time should people seek that professional help that you're talking about, and what are the first steps in doing so?
Sure. You know, one other thing I want to mention, Zach, is that people need to be aware that if they've experienced prior trauma, that even witnessing an event like what happened the other day can be re-traumatizing, meaning that even if you yourself were never in an actual mass shooting, if you have had history of trauma, like even witnessing domestic violence, witnessing something like this can bring up those feelings and thoughts from that prior trauma and actually, you know, induce post-traumatic stress. So what we want people to be on the lookout for is that if you are experiencing these symptoms over the course of a month and they don't seem to be going away, that is when we would want people to seek out therapy. And that can look a few different ways. That can mean asking your primary care doctor if they have any recommendations for who you could see. If you have insurance, most insurance companies will give you a list of individuals who can provide therapy and take your insurance. And again, the idea here is that we want people to err on the side of seeking help when they are feeling overwhelmed and feeling like they might have those symptoms of PTSD.
And of course, we're saying 30 days, but you could go sooner if you identify you need it sooner, or even later when you're experiencing difficult times beyond that 1 month mark.
Absolutely.
Yeah. I want to talk to you about parents' reaction when it comes to these types of incidents. We know the investigation is going to unfold. It's going to go beyond the church where the incident happened on Sunday. What do we want to tell parents to be mindful of, to be cognizant about when it comes to their reactions in front of their children?
Yes, it's such a great question and so important because we know that kids are actually like sponges. They will pick up on the emotions of their caregivers and those around them. And so it's very important for parents to be aware if they are feeling overwhelmed, if they are having symptoms of post-traumatic stress, if they're even demonstrating a lot of anxiety around their child, that child is likely to become more fearful. And so the most important thing in terms of helping kids to not develop anxiety and to, be resilient is for the parents themselves to be seeking help, whether that means just seeking social support or doing things for themselves to take care of themselves or actually seeking therapy. But again, parents are, give their children cues about how to respond to certain situations, and kids will soak in that information.
Okay, all good information for us this morning. If people are interested in getting in contact with you or the work that you do at the Institute, how can they go about doing so?
Sure. We have a website. It's just www.tagcenter.org, and you can find lots of information there. We also have resources for caregivers on our virtual learning library that are freely accessible about how to talk to kids about situations like mass shootings or other types of traumatic events.
Dr. Kaplow, thank you so much for your time this morning. We do appreciate it.
Thank you.